So stewardship programs are increasingly using these prediction scores as tools to optimize antimicrobial selection. A lot of what we do, particularly to improve the quality of care for patients, is to get the right antibiotic on board as soon as possible. So we know there's lots of literature that would support the sooner you get a susceptible antibiotic on board, the better the outcomes will be for the patient. And of course, we have national guidelines that will give us some guidance as to what the top tier agents would be for empiric selection, but oftentimes those lists can get kind of long. They can have maybe 9 or 10 options, some of which are moderate in spectrum and some of which are very large. And so prediction scores would give you the ability to kind of customize it to the specific patient that you have come to you. And it also creates a language in terms of probabilities that you could discuss. This individual patient that's coming to me has a 0.1% risk of having Pseudomonas aeruginosa at baseline, versus this other patient B has maybe a 22% risk of Pseudomonas. And using that terminology, we can start to quantify probabilities and then come to an easier way of communicating and negotiating a treatment plan with general providers. So it's a great tool for antimicrobial stewards, and I find that it helps providers on the front line, whether they be stewardship or not, to really gain confidence in empirical antimicrobial selection for their patients.